Chapter 5, The Birth of American Dentistry.
Chapter 5 explores the thrilling origin story of how dentistry grew. Throughout the narrative, we were able to see the first contributors to the art of dentistry, Chapman Harris and Horace Hayden, how they explored the unknown of science at the time, along with discoveries they made in what we now know about human anatomy of the oral cavity. The chapter ends with a more recent story about a young boy who passed away from tooth decay.
There were also others that made waves in dentistry. The French surgeon, dentist Pierre Fauchard, started focusing on using scientific principles in dentistry. He used a microscope and debunked tooth decay coming from gnawing worms. Joseph Fox was a dental surgeon in England. He traced tooth sensations to the trigeminal nerve, documented tooth anatomy, and noticed small children were not exempt from tooth decay. John Hunter performed tooth transplants. He experimented with a bud of a human tooth and transplanted it into a rooster's comb in 1778. He knew it did not always work, but people would sell their teeth for money. There was a risk for oral infections and syphilis. Harris and Fox believed tooth transplants were too dangerous.
Chapman Harris was instrumental in dentistry. He was born in early 1806 and trained in dental practice by his older brother. He had no formal training. Harris spent his career stressing the importance of the teeth to the entire body. He performed procedures referred back then as scraped, drilled, and extracted. For pain, he used leeches, arsenic, nutgall, and mustard seed, laudanum, and vinegar.
Chapman Harris' contributions to dentistry wrote world's first college dental textbook in 1838, The Dental Art, published in 1839. The book contained anecdotes, case studies, taught lessons, and illustrated principles. He made the systemic link of dental caries and severe infection when treating a patient, Miss W., who had severe caries in the maxillary that spread through the maxillary sinus, through her cranial bone and into her brain, which led to her death. He edited, annotated, and published a series of lectures from a British dental surgeon, Joseph Fox, in an American addiction. Harris elaborated that gold should have been used instead of other metals. He also discovered that caries happened from outside instead of inside out, like everyone else thought.
Who is Horace Hayden? Hayden was born in 1769. The beginnings of Hayden's dental studies were traced to a 1792 visit to the New York dentist, John Greenwood. Fun fact, John Greenwood's initials were engraved on the dentures of George Washington. Harris also practiced medicine and dentistry. He served as an assistant surgeon, and he wrote papers about teething and ulcerations of the tonsils.
The partnership of Horace Hayden and Chapman Harris. Hayden and Harris met in Baltimore and worked together to create professional training. Harris believed dentistry needed a scientific journal. However, Hayden felt he had worked too long and hard in his acquisition of knowledge to have it broadcast through a magazine. However, the first issue of the American Journal of Dental Science was published in 1839. Harris served as the editor for years. In 1840, the pair created the American Society of Dental Surgeons. It became the first dental organization.
The historic rebuff. Harris and Hayden's attempt to add dental instruction into the curriculum at the University of Maryland Medical School. During Harris and Hayden's alliance, they contacted the University of Maryland Medical School to add dental instruction to their curriculum. However, the two parties never agreed on adding dentistry. This was likely due to the fact that the physicians were facing other demands and pressures at the time, legal and epidemic issues. Because of this, in 1904, the event was named the Historic Rebuff. Some believe this was the beginning of the medical/dentistry split. Instead of dental care being a specialty of medicine, it became a separate and independent health service. Harris and Hayden were passionate about the alliance with Maryland Medical School because without formal education, dentistry would remain a humble trade.
Due to the failure of merging dentistry with medicine, in 1840, Hayden and Harris opened the first doctor of dental surgery school in Baltimore. Hayden was the president. Harris was dean, as well he served as a professor of operative dentistry and dental prosthesis. Their first graduating class was in 1841, and it had 5 students.
The Harris-Hayden fallout. In 1842, the partnership ended after a disagreement over conflicting paper theories on diseases of the maxillary sinuses. Hayden passed away in 1844, and the American Society of Dental Surgeons Harris and Hayden founded forced members to sign a pledge to abstain using the restorative metal amalgam known as the Amalgam War. Many refused, and after the journal was filled with arguments over the dangers and merits of mercury amalgam, it collapsed in 1856. Then Harris passed away in 1860, and dentistry focused on surgical procedures. But far few dentists would concern themselves with social medicine, researching wider patterns of disease or the delivery of oral health across populations. Far few worked in labs, researching the microscopic causes and conditions underlying health and disease. The profession now would remain focused on surgical procedures needed to treat tooth decay and other symptoms of oral disease.
Fast forward to 2007. On January 11, 2007, DeMonte Driver came home from school not feeling well. He had complaints of a headache. DeMonte was sent to the hospital and given medication for a headache, sinusitis, and a dental abscess. DeMonte was sent home, but he was much worse the next morning. DeMonte was sent back to the hospital, and a spinal tap and CT scan showed he had meningitis in his brain. He was quickly transferred to Children's National Medical Center in Washington, D.C. to undergo brain surgery. The first brain surgery was unsuccessful, and during the second brain surgery, the doctors removed the abscessed tooth. DeMonte's recovery looked promising, but unfortunately, after weeks in the hospital and over $250,000 for care, DeMonte Driver died on February 25, 2007 from tooth decay.
Comparing and contrasting the differences and similarities between medical and dental. Hospitals and treatment centers are available for a wide variety of needs. A person can go into a hospital to receive care regardless of financial state. For example, an ER has to treat a person who came in an ambulance that was in a car accident. Payment is not collected before services are provided. However, it's rare to find a 24-hour emergency dental clinic, and dental offices are not obligated to treat a patient who walks in with a dental infection. There's also a lack of understanding about dental health in the medical community. For example, in the book, we read that the physician of Miss W, making a reference back to the patient that Harris saw, the physician she initially consulted for the pain that she was experiencing in her cheek did not use the word infection to describe the abscess that she had. To this day, a dental practice is still separate from medical. It is its own entity, and now that includes insurance as well. In the book, there is a quote from sociologist Robert O'Shea, who is a current sociologist. He said, "Thus began the split which is not yet healed," and that's very evident in the way that we see dental and medical today. It's been almost 200 years since both the cases Miss W and DeMonte, and they shared similar fates of untimely deaths because of tooth decay. As we learned last week in lecture, Medicare and Medicaid plans either don't offer dental coverage, or the coverage is very limited and difficult to qualify for. There are some similarities. They both accept insurance. They both have a population lack of basic understanding. And it is still difficult to receive necessary medical care, though it is more difficult to receive necessary dental care.
Why do we rush to get treatment for this, but not this?